Good morning, everyone. We want to go ahead and introduce ourselves. We're just going to do self-introduction, so I'll introduce myself. Elridge, I'll let you introduce yourself. A little bit about me. I am an attorney or counsel. I work for the South Carolina. If you can't tell it in my accent, you'll hear it in my accent every time I say y'all with you. I work for the South Carolina Senate. I'm counsel. I work on drafting legislation, developing policy. I interact with lobbyists, with liaisons, and come up with various write speeches, do all kinds of things you can imagine. I'm also former chair of an organization called the National Conference of State Legislatures, which basically makes up all of the state legislatures in the United States. I have basically connections to different state legislatures, and I'm kind of here to give that perspective, a little bit of the perspective of from the state and what you can get involved with at the state level. But I'm also here because I'm like you. I'm an ALK Positive survivor, actually. Part of ALK Positive. I don't want to get into a lot of detail. I could spend a long time talking, but my quick story is in 2017, I actually had a massive heart attack and had to have triple bypass surgery. Recovered and survived that, and considered myself a heart attack survivor, and then thought that was going to be the biggest health thing in my life. I got it out of the way, you know. What worse could come along? And then a few years later, I was diagnosed with ALK Positive. Originally, I was diagnosed with just lung cancer, and my original doctor at the time, when we went into the office, essentially, with my wife, who's here, and our daughter, Parker, that was 7 months at the time, we were in the room, and he had no game face. He just straight up walked into the room and went, "Oh, is that your three? Oh, that's not your daughter, is it?" You know, that kind of thing. And said, you know, you've got 6 to 16 months to live. Didn't offer any biomarker testing or anything like that. It was straight up based on the biopsy. So I went and got a second opinion, and when I got the second opinion, the doctor's first thing they said is, "Have you had biomarker testing?" And I said, "No, what is that?" And so I did the Garden 360, and it determined I had ALK Positive. And my first doctor was ready to just do chemo and radiation, and now I'm going this route of medicine, right, that we're all on and we're all fortunate to be able to take. So it completely changed my outcome, and I found out that there's no rules or laws really in place that require them to talk much about biomarker testing, and that a lot of insurance companies don't cover it. So I use my inside sources and my skills with working within the legislature to start finding out about states that have passed biomarker legislation that requires biomarker knowledge and requires biomarker insurance coverage. And so that kind of got me involved, and then I talked to Kirk with ALK Positive about ALK Positive's role in becoming more policy advocate oriented, and Kirk said, yeah, it's a big thing. So anyway, that's a brief introduction of me, a little bit about my story and where I came from in the advocacy world. And so I'm going to turn it over, Elridge.
Well, good morning. I think it's still morning here. I'm pleased to be with all of you for what is my first ALK Summit, so thank you for having me. My name is Elridge Proctor. I'm the Senior Director of Government Affairs at GoTo for Lung Cancer. To tell you a little bit about my background, I came to GoTo with a background basically in policy, direct work experience from Capitol Hill, and some executive experience from previous nonprofit organizations. But I came here to help shape policies that benefit in a positive way the lung cancer community. Over the years, I've worked to help restore $20 million in lung cancer research funding, which is a program I hope to be able to talk more with you about. Turn it back to you.
Thank you, Elridge. Just let me briefly, before we get into the details of what you're really here for, let me say two things. One is, due to the time we have, basically, I could tell you, we could put on a whole weekend summit just on policy advocacy. As a matter of fact, GoTo puts on a weekend, a whole summit just on policy advocacy. So we're going to give you the not the 30,000 foot view. We're probably going to be to the 130,000 or higher view. So just want to let you know we're going to hit the highlights, but there will be follow up I'll talk about at the very end of the session that'll give you an opportunity to get deeper dive training. Secondly, We are not here. ALK Positive is nonprofit. Is a nonprofit, and ALK Positive is nonpartisan. ALK Positive is not a Republican or Democrat. Does not push candidates. Does not push electing certain officials. What ALK Positive does do is push for more awareness about lung cancer and ALK Positive, and also pushes for more research funding and things at that level. So we're not today going to be attacking any parties or political views or anything like that. We're going to be giving you the facts so that you're all better informed about the landscape, and then you're also a little better informed about how you can get involved. So with that, I'm going to go ahead and ask a few questions. I want to get with you with Elridge. My first question is, from your perspective, why is policy advocacy so important, especially right now and what's going on?
Well, first, let me just answer the question, is advocacy important? And the answer is yes, very important. If we don't let our lawmakers, if we don't let our voices be heard and tell them how to represent us, you elect them to represent you. And if you don't tell them just how to do that job in representing you, we can see further reductions in lung cancer research, as well as access to care. You've been hearing it throughout the summit from Dr. Christine Lovely, how critical clinical trials is. We're counting on researchers who are publicly and privately funded to develop new treatments to save lives. Advocacy plays a strong role. Sorry, I'm coming in and out of here. Just to put it in perspective, over the past 6 months, many of you or all of you may have heard or seen reductions in what we consider federal research funding. You may have heard about cuts to federal research agencies such as the NIH, the CDC, NCI, and of course the Department of Defense. Well, I'm here to tell you that advocacy is what plays a role in all of that. The federal government funds most cancer research programs, and there's no other entity that can fill that gap. So if we do not let our voices heard, we will not get the just amount that we should be receiving in lung cancer research funding. Also, it's important to understand that your lawmakers will listen to you when you tell them how to represent you. Advocacy matters because it gives a face to lung cancer. It lets them know in a personal way that lung cancer is real and that it's an urgent issue that deserves immediate attention. People like you who are diagnosed with lung cancer, people who may be mothers, fathers, sons, daughters, sisters, and brothers, people who can hold lawmakers accountable, and that's you, the voter. So it's important to let your voices be heard. And the other theme that we've heard about here is how we're stronger together. Advocacy makes us stronger. It is powered by people like you, the patients, survivors, and caregivers.
Yeah, I think you've emphasized an important part, and that is the personal aspect of the patients, and why this meeting is taking place, and why you're here, and why you're listening is how you can get involved. No offense to you, Elridge, but Elridge, you were not a cancer patient, right? But you are a lobbyist for the organization, and so the lobbyists can go up and they can talk to the elected officials all they want, they can testify all they want, but the real impact, and disagree with me if you do, but the real impact to me at the state and federal level comes from the patients, the real patient, the cancer survivors telling their stories, like me telling my story about the biomarker testing, or you telling your story about biomarker, or you talking about how that funding is going to cut a research project, that's going to cut funding, that's going to cut a trial you're supposed to be in, so I'm assuming you agree with that, but let me just kind of follow up.
Absolutely. No one can tell your story like you can. It's up to you. Just as in a conversation with your medical teams, you describe the impact that lung cancer is having on your daily living and activities. You would do the same thing with your lawmakers, help them to understand the real impact of their decisions on your lives. Advocacy touches everything we eat, do, just our daily lives. And you have the power to hold them accountable and help them to represent you and your needs. So you should be asking them for support.
And let me add to that, because we may have some researchers and some doctors in the room. Your expertise is also important to being able to testify and send information about what you do and how things at the federal and state level impact on that. So let's talk a little bit about what's happening at the federal and state level. Obviously, most of the activity at this point and what you're seeing on the news is at the federal level. So I'm going to let you first talk a little bit about what's happened this year, talk from that standpoint, and let us know a little bit about, inform this group, because there's been a lot of confusing news about what's happened at the federal level, and then I'll mention a few state issues.
So yes, to put it in perspective, we've been dealing with an unprecedented amount of cuts to medical research, and that is just throwing instability in the environment and in the space and in the field, as you heard from Dr. Lovely, uncertainty about federally funded research at this time. Let me be more personal and talk to you about the lung cancer research program. You heard me mention that earlier on. About 16 years ago, my organization, Go-To for Lung Cancer, worked with Congress to establish a lung cancer research program within an account known as the Congressionally Directed Medical Research Program. We use the acronym CDMRP. If some of you have heard that, that's what I'm talking about. And what that essentially means is that the program is not funded at the NIH. It is not funded by the president's budget. It is funded by Congress directly. And so Congress has the power to determine how much and how to fund this program. And so this lung cancer research program looks at the cause of lung cancer, how to treat it, and the prevention of it. What has happened is that last year, and first I should go back to share that the program requires annual funding. So we work to secure funding for it each year. Up to date, just to give you an idea, I would say Congress has invested over $250 million since the program was established in fiscal year 2009. Federal government deals with fiscal year and not calendar year, so we're always a year ahead. Last year, we secured $25 million for what is this year's fiscal year 2025 Defense Appropriations Act. Because Congress could not agree on a spending bill, it then passed a measure this year known as a continuing resolution. With that continuing resolution came a significant cut to the account that I just mentioned, the Congressionally Directed Medical Research Program, of 57%. That cut completely eliminated funding for the lung cancer research program in this year's budget. As a result of advocacy, Congress pretty much lumped in the lung cancer research program with 21 other cancers to now compete for funding for the rest of this year. So we've continued to advocate for restoration, in addition to an increase for this lung cancer research program. And so currently, in what Congress is working on as fiscal year 2026, which will be next year's budget, we can say that Congress has brought back the standalone lung cancer research program, but has funded it at a much lower level at only $15 million for next year's budget. So we're seeing cuts across the board to all federal research agencies, and lung cancer is included. And we already know that lung cancer is underfunded compared to other cancers. And so what we have to continue to preserve as well as seek increases too. Okay, so I was just gonna say, looking ahead to next year's budget, you all can help change the trajectory of that. It sounds like we're greatly challenged in advocacy, and it can be a daunting role that most advocates don't want to take on, but I'm just sharing with you how it is working. They're listening to us. We're not getting everything we want, but we were facing a complete elimination to now back to having a dedicated lung cancer pipeline with some level of funding. So please join the fight Bring your stories. Your story is the argument. I don't have to argue with Congress. I tell them your story, and that's the argument that's presented that wins the case each and every time. So thank you for that.
Is it fair to say that the funding cuts that are taking place to cancer research and in all these areas of cancer funding, that this level of defunding or cuts to funding hasn't happened in decades, hasn't happened in a long time? This is a big difference this year from what we've seen over the previous however many years.
To not be political, I would say that yes, we call it an unprecedented level of cuts to biomedical research for a number of reasons. Some of this could have been to lay the foundation for, not to complicate matters with you, but most of you probably heard about the One Big Beautiful Bill, which is another budget bill. So simultaneously, Congress was addressing two budgets. You've got the annual spending bills, which is the appropriations, and then you have the tax bill, which was a budget-related bill. And so in order to find savings, there has been significant reductions, and then not to mention what DOJ considered itself the efficiency group. So savings and efficiency is what the government says that it was looking to do. And so every federal research agency has been on the chopping block, and lung cancer is not spared, even though we are the leading cause of cancer-related deaths. I will say that all cancers have received a cut. No one has been spared. And in fact, let me just share with you, within the Department of Defense's CDMRP program, there's 35 cancers that are funded, and we're one of the 35 cancers, and 12 of them was able to retain their line item when the 57% cut occurred, and the 20, whatever, I can't do math, the 24 of us that were remaining pretty much were eliminated for this year. So we're not alone. This is actually a time when we need to band together to let Congress know we will not stand for a cut to medical research.
So in layman's terms, kind of, what's the impact on research funding? Like, why does this impact us at a personal level? I guess I'd say based on my own understanding, so most of the research funding, I think you mentioned earlier, that goes into cancer research, lung cancer research, comes from these federal grants. And so my thought is, by cutting these federal grants, you're not supplying that research money, and that therefore, if you're not supplying the research money, then there's less research out there going on. There's less research going on out there, there's less treatments and cures, and it's just prolonging everything out. So ultimately, what I consider this the golden age of cancer treatment research and everything, but this could potentially push that back, and potentially there could be folks in this room impacted by that. Is that right? Is that fair to say?
That is absolutely correct. Dr. Lovely said it best. Your treatments come out of clinical trials. Without the funding for clinical trials, there will be a halt to new treatment discoveries, as well as diagnosis tools, as well as your access to care. Everything is on the chopping block. So it's biomedical research and public health together that we're seeing an impact because of the reduction in funding.
Okay, so it sounds critical that everybody get involved. How do you get involved? Like, what's the first step? Like, I think if a lot of people feel overwhelmed and say, do I write my congressman? Do I send them an email? Do I have to fly to Washington? Like, what's the first steps for folks who've never gotten involved to now get involved to basically change the situation that's going on right now?
The first thing you should do is, first of all, is prepare yourself to share your story. That may not be easy for some of you to do, and you may, I've heard that some like to keep their journeys somewhat private. But in this space, when you speak up for yourself, you're also speaking up for the community. And that's part of advocacy. It's supporting each other in this journey. Your advocacy can also support the rest of your journey as you improve your access to care. I would suggest that you join with organizations that gives you the opportunity to share your story. For example, at GoTo, we make it very easy just by going to our platform. We have an online platform with just a click of your mouse. You're able to send an email, a tweet to your members of Congress, and it allows you to personalize the letter that we provide to share your story. We also host an annual advocacy summit, similar to what you're doing here, but this one includes direct advocacy with members of Congress, where I plan all your meetings and provide you in-depth advocacy training and help you to make the ask for support. And that annual summit is being held next year in March 1st through the 3rd in Washington, D.C., and we encourage you to consider joining us. It is in person, and it's all free to join. Other ways to get involved is exactly what JJ said: writing and even calling your representatives. And if you're not able to make it to Washington, D.C., visit their district or state offices. I think it's important to go in, introduce yourself, and share your story. Put a face to lung cancer. It is not just any other disease. It is something that is personal to you, and it has a personal impact. Whether you're a medical professional and you want to talk about your patient story, or if you yourself are the patient and survivor, you want to share what's happened to you, or if you're the caregiver or the family member, you also have a story to tell, and we should be telling it, and we need to be louder than any other groups. If we want to receive an increase, then we also need to increase our voices and our numbers. Advocacy is powered by people, and we need you.
Okay, thank you. And I want to mention, we have you from GoTo. There are other groups out there who are advocating for lung cancer, and those groups all collaborate with one another to work together, not work against each other. But I want to mention them. So if you're out there doing research and Googling for how you can get involved in policy advocacy on lung cancer, there's groups like the Lung Cancer Action Network. There's GoTo, there's Live Lung, there's the American Cancer Society's Action Network. All of these organizations you can go to and sign up and get alerts about action you need to take. Find out how you can send emails to your congressman and to your state officials and things. So there are multiple ways you can do that. And I just want to also mention that ALK is talking about, in addition to this meeting, this is kind of a kickoff. This is kind of a starting point, providing some deep dive ALK talks where I can provide some training of exactly who you need to reach out to, how to reach out to. There's advocacy and there's effective advocacy, right? So that's a deep dive training. So I look to offer that. I also want to let you know that ALK Positive is getting involved at a organizational level now, has joined the Lung Cancer Action Network, and also will be working together more closely in the future. You'll start seeing a little more emails, a little more policy activity coming from ALK Positive itself. So it's not just you, it's the organization as a whole that I want to mention about, so that you understand that there's a lot of ways to get involved. And then again, at a future date, I'll be teaching about effective advocacy. So that's part of it. We don't have a whole lot of time left, so I want to say, get some final thoughts from you to make sure, is there anything you hadn't had an opportunity to share with the audience so you could share?
I'm just going to say that I hope you all leave this ALK Summit feeling truly inspired, hopeful, and empowered, and then you let that fuel your advocacy. Go and tell your story. In fact, every time you share your story, you're advocating. That's all I want to tell you. And you're good at it because it's your story and it's your journey.
Thank you. So I'm purposely wearing this shirt that's more research equals more life. We hear that all the time, right? But I really need a shirt that says more involvement equals more action by the government, which equals more funding, which equals, more research, which equals more life. So the more you get involved in policy advocacy, the more life, right? Let's just shortcut it to that. So let me say that, and let me go ahead. We'll do a couple of questions. We don't have much time, I think, because we're going to have to move in a minute. But I want to go ahead And before we even get to the questions, I want to go ahead and thank Elridge for being here today and everything, and appreciate your comments. And I'm sure we'll both be around we got to run to the next session, but catch us in the halls and talk to us before you head out of town, and we'd be glad to answer your questions. But I want to thank Elridge, if you don't mind, for. All right, we'll take a couple of quick questions, and I see 2 hands over here, so we'll take those 2.
I just want to give a plug for Go To Summit. I've got 2 years in Washington, D.C. Elridge, they create such a easy, everything is done for you, and they put you in groups by your state. And you actually get to go to the Senate and Congress and speak to your particular representatives about your story with other. And how important it is, because lung cancer, if you think about it, most lung cancer patients aren't well enough to go out and speak for themselves. But us with oncogene mutations, the EGFRs and the ALKs, are the ones who are showing up at these meetings, and I think every year it's more and more. We're growing. And I think the reason why breast cancer got $150 million in the past is because the women went to DC and their voices were heard. So our voices need to be heard. And the only way to do that is since we're living and we're healthy enough, let's get out there and do it together. So the more they need to hear from us, because they don't get it. They don't get it. And you have a chance to stand either in front of them or their staffers, but you get your message out, and it's done in numbers. It really is. So Elridge will hold your hand all the way through. They prepare you, they teach you. You go out together in teams. You're not alone. You have team leads. All you have to do is bring your story. It's very easy. So let me advocate for that. And it was the first year was great. The second year was very upsetting that face-to-face they told me, sorry, we don't care. It's not about you this year. It's about diabetes. It's about food safety. And I mean, I was crushed. So now I want to hear everything you have to say, and I'm going to do, because I want to fight, because this is the funding that we need. Otherwise, nobody's going to choose to go into medicine anymore if there's no place for them. So that's what I have to say.
Thank you. Thank you. So we're going to go ahead and with a quick question.
I'm from New Jersey, so I wrote all my congressmen and the senator, and I heard back from them, and they are against the cuts. But who else can I write to? If my state is against all those cuts, who else can I write to?
Sure. So let me say this. One time is not sufficient. And I understand what's happening politically. What happens is when the Democrats are in charge, they say to you, oh yeah, we're with you, go talk to the Republicans. When the Republicans are in charge, yeah, we're with you, go talk to the Democrats. But as I said to someone earlier today, it doesn't matter who's in charge. Your representatives are who you elect to represent you. And just as you're fighting, and I don't want to use the word HELL, but just as you're fighting as hard as you possibly can, you need them to do the same for you. And so it isn't enough. It isn't sufficient to say, oh, you're good, I heard you, I'm done. Where's your fight? Where's your counter offer to what's on the table, to what's being proposed? We elect members to legislate, not to protest, not to do anything else, but to do just that. So you've got to push them and say, well, are you putting in the highest amount in your appropriations request for lung cancer research? Because there's still work to be done. Hold them accountable. That accountability is the greatest piece to all of this. So thank you for what you've done. And thank you, Nikki, for your comments as well. I appreciate you and your advocacy.
All right. Well, that wraps up this session. I appreciate everybody being involved. Thank you. Thank you.